Okay, I'm here at Innovative Sports Medicine in Springfield, Missouri, where Dr. Jeremy Reed is going to do PRP in my hamstrings. I can tell you that I have full confidence in him and his staff. They are amazing. I've had several patients come to me from him after either having PRP or stem cells or another type of regenerative medicine treatment, and they've had really great outcomes. So I'm very confident on starting this journey with him. So stay tuned and I'll keep you posted on how it goes. All right, here we go. Yep. Why would you do PRP on someone like me?
I think you in particular with your injury, having multiple areas of hamstring dysfunction and injury, I think that PRP is a great option because we can get enough blood and enough platelets to hit multiple sites safely with you and dump a whole bunch of growth factors into those hamstrings and give you the best option to get you over this injury, since you've already tried all the conservative stuff most appropriately, like eccentric strengthening and stretching and core work and all of those wonderful things you've already tried and will continue to do. This is just an added benefit.
Thank you, Dr. Jeremy Reed. And Faye, you're so amazing. Hi. Get a little. This is all the crazy equipment we're going to use today. Woo woo! Oh yeah.
Is that good?
That's very good.
So you'll see it's all red right now.
So go and look at it.
Okay.
It's cool.
So this is pulling blood from the whole blood end bag, right?
Okay.
It's just, pipetting it basically into that disc, which is it's a blood bag that's at the bottom of that disc in a centrifuge.
Cool.
And as it spins, once it takes all of your blood, the RPM will sort of increase, right? And as it gets faster, the hematocrit, which is the red part of your blood, the red blood cells, will get thrown. They're the heaviest, right? So they get thrown out to the periphery.
Right.
The plasma, which is just the liquid, is the lightest part, and so that gold that she's talking about will come into the center. And what we want is the PRP layer, which is the area in between.
Okay.
The gold and the red. So what's going to come out of that machine is going to be kind of pinkish red, and that's the good stuff.
Cool.
And there's a layer that you can't see that's in the middle, right?
Okay.
It's called the buffy coat.
Yes.
The buffy coat has whites, a few whites.
Okay.
It also has all those platelets, right? And we're likely to increase the concentration of platelets and allow a few more whites and therefore reds into that sample because, for whatever reason, muscle and tendon like white blood cells. But if I'm going into a joint, purely into a joint, the cartilage in the joint does not like those white blood cells as much. So that machine is one of the only machines that actually lets us choose what concentration of platelets, what concentration of whites, what concentration of reds we allow, right?
Which makes you very unique to other people that do PRP, correct?
It's the only kit that I would have. It's the only kit that is up to our standard. And
I like
it's more expensive, but whatever.
I was going to say, if it's worth it, it's worth it.
So it's the machine is now pipetting that platelet core plasma out into the bag here. And there are growth factors associated with platelet core plasma as well. So sometimes we use just a whiff of it combined with PRP. And when it reaches the buffy coat layer, it will know because of that blue light right there. That's a light spectrometer. Your typical chemistry class, light spectrometry basically calculates the density by how much light penetrates through the tubing.
Okay.
So it knows the density of that buffy coat layer where the platelets are. And when it senses the beginning of that buffy coat layer, this thing turns around and puts the PRP into that syringe automatically and sterilely, so that we don't have to manipulate it at all, which is really cool.
Yes,
Keep
it is.
clean.
Very, very cool.
And when we're done, the kit all goes in the trash because it's yours. So
I'll
the machine's ready to go again. So we drove
There it
all that
is.
blood, right, to get that much zinc, which is crazy. That stuff's gold.
Pure gold right there.
That's funny, because like Nathan's in here watching TV all day long. I mean, Story said we need some pepper. He said, well, she said, well, how do you?
I get your hand just
1, 2, 3, poke. She always does that. She always like freezes my fingers on purpose. Trying to make it pretty, Kens.
You can see the needle.
Yeah. Doing okay?
Yep.
Am I killing you?
Nope. All good.
I'm trying to get down there to it. I'm going to push on you a little bit.
Mm-hmm.
Yeah. Right. Says the law school attendant.
Sick.
Says the law school attendant. It's gross. Okay, lots of pressure again.
Mm-hmm.
Oh, this little 25 gauge is such a bear.
I'm glad this is all in video.
Yeah, me cussing this needle.
Mm-hmm. It's all good.
Yeah, this one's even better. Good video.
That's crazy looking.
This one's gonna be the one you want to show your friends.
Sweet.
All right, hold that.
Yeah, I know.
Love it. I love it. It's fascinating.
Am I hurting you?
No.
A little achy?
Yes.
Okay.
Do you need more air?
I'm good. Yes, you did.
That's a big needle.
Good.
Maybe I have a career in this after all.
I heard you got accepted the other day.
Good.
UKC.
Well, that's law school.
With a
Woo-hoo!
scholarship, too.
With a scholarship?
Congratulations.
Oh.
Yep.
I made you
Felt that.
touch. I'm
Felt that
sorry,
one.
sweetie.
All right.
Now if only Mizzou would call me.
So your tibial nerves right back here.
I felt a little something nervy.
Down your leg?
Mm-hmm.
Is that what that blank space is?
No, that blank space is goop in her hamstring along her tibial nerve. I'm trying not to murder her tibial nerve too badly.
I think this is a good video. It's very
But-
clear.
Right? Perfect. That was a good call to do that there.
Oh, yeah, that was needed.
Good.
Wow.
So what I'm doing, Jessica, is I'm pressure testing that hamstring with my needle, right? And it's failing miserably. Okay.
Okay. Whoa.
Knee bone. You doing okay, girl?
Oh yeah.
Last one, okay?
Perfect.
And now I'm going to try not to tickle your peroneal nerve.
My lovely floppiest floppy foot.
Failing that pressure test there, too. Okay.
Sweet. Like I can run on Monday.
If you feel like
If I feel like running on Monday, I can run on Monday. Okay.
Yeah.
Sweet. This is, I'm telling you, my running group will be so happy to hear that. They'll be like, I can run 3 days.
I wonder if you're gonna feel like it though.
No, I know. I
gotta
may
be
not feel like it. No, that's
really
fine.
honest.
Yep,
that
no, that's fine.
While
If I
you're
don't-
loud, I would be really surprised.
That's a whole lot of needles, guys.
That's why you're going to break that narcotic barrier today.
Well, I made it and I'm out. It was uncomfortable. It was not awful at all. I took some really cool videos that I'm going to post in here in a little bit. If you don't care for medical posts or needles or something like that, I would suggest not watching. But they're fascinating and really cool, and it explains the procedure. It's fascinating. So I will post those here in just a little bit.